Are you sure?
Good morning, everyone. Thanks for joining us today. I see some more participants trickling in, but we're going to get moving to keep us on time. Thanks for joining us. This is exciting. It's our first IForum of 2021. For those of you familiar with the IForum series at the Partnership for Strong Communities, we used to hold them in the Lyceum in our awesome building in Frog Hollow. We had delicious food provided by the Kitchen Forge City Works. So I miss the pastries and the fruit and the coffee and being able to mingle with all of you before and after the event. But at least for now, we're going to continue format, and we're excited to share some really awesome panelists doing some fabulous work with you all today, as well as a great national expert who's going to give us some really great high-level information about what's happening with homelessness prevention. So for those of you who are new to the partnership, my name is Kylie Goslin. I'm the executive director of the Partnership for Strong Communities. We've been around since the late 90s, and we're a statewide policy and advocacy organization dedicated to ending homelessness and expanding housing opportunity in Connecticut. We're the backbone organization of the collective impact campaign known as Reaching Home, the statewide campaign to end homelessness. And for many of you who may be a part of that campaign, you already know that a couple of years ago, we went through a reorganization and restructured the campaign. And as part of that effort, we merged a lot of our prevention work into one prevention work group. And part of the purpose of that, as determined by the many members that make up the Reaching Home campaign across the state, was we all felt that a focus on prevention was really critical to getting us across the finish line and reaching our goal of making homelessness rare, brief, and one time in Connecticut. And since the Reaching Home campaign started in 2004, we've seen a tremendous decrease in the number of individuals and families experiencing homelessness, but we know we still have a lot more work to do. And a lot of that work needs to be done in the space we're here to talk about today, which is about prevention, about making sure that those families don't ever make it to the front door of our shelter system. We're also doing that with an increased focus on incorporating folks with lived experience into the campaign, and being increasingly aware of and focused on the racial inequities that lead to many families finding themselves in our system, and the ways our own system may perpetuate those racial inequities. So at today's IForum, we wanted to share with you some of the good work that's happening in the prevention space and learn a little bit more about that. We will be talking about some initiatives that have just been launched or are planned to launch soon, and we'll share a national perspective as it relates to prevention, which will reinforce some of these innovative efforts in homelessness prevention, which again are critical to saving lives and also to making better use of our state and federal resources. Sharon McDonald is here with us today from the National Alliance to End Homelessness. A link to her bio and as well as the speakers that will present at today's IForum is being added to the chat for your reference. So before I hand it over to Sharon, I wanted to run through a couple of housekeeping items for those of you who are joining us today. You're probably familiar with Zoom at this point, but just to note that this event is being recorded, and that's so that we can make it available to all of you moving forward through our website. All attendees, that's all of you, have been entered muted and will remain on mute throughout the event. If you have technology questions or difficulties at all during the session, I encourage you to send a message in the chat box to the meeting host, which is PSC Zoom Meetings. That's all one word, PSC Zoom Meetings. And then finally, we are going to have some time, hopefully at the end, if we keep ourselves on time, for some question and answers from all of you and our panelists. So please submit Q&A in the box in the Zoom control panel, and the Q&A box in the Zoom control panel. Mine is at the bottom of my screen, the bottom center. We'll hold time again and try to get to some of those questions or feed them to panelists throughout the session. Now I'd like to introduce Sharon, who again is going to introduce some national perspectives and help us moderate today's discussion. So it's a pleasure and a privilege to introduce my former colleague, Sharon McDonald. Sharon has been with the National Alliance to End Homelessness since 2001, where her work has focused on families and children. She is the Senior Fellow for Families and Children at the National Alliance. And she has a background also as a practitioner in the area of providing service and enhanced housing for low-income families, as well as those living with HIV and AIDS. She worked for one of my favorite politicians of all time, the late great Senator Paul Wellstone, as a congressional fellow focusing on welfare and housing issues, and has been a licensed clinical social worker since 1991. Sharon also holds a doctorate, a PhD in social work and social policy from Virginia Commonwealth University. So with that, I'm going to hand it over to Sharon to kick us off. Thanks for joining us, Sharon.
Thank you so much, Kylie. And I'm really grateful for the opportunity to be here and to learn from Connecticut. Everyone in the nation is constantly learning from some of the work that's first starts in Connecticut, and we all benefit from your innovations. So before we get started with the panelists, I wanted to just go over some basics about what we know and what we're learning about homelessness prevention. So if we could go to the first slide. So the most fundamental is that preventing homelessness is an entirely different endeavor than preventing an eviction. Traditional eviction prevention programs are not targeted or designed to help people most likely to become homeless. A study of a program in Chicago found that less than 1% of people facing an eviction that received assistance became homeless within 6 months. However, only 2% of people who were not assisted became homeless when denied help because the agency had run out of funding. The next most important message is that predicting who will become homeless is extraordinarily challenging and is something researchers are striving to improve with data by improving the quality of the data. The California Policy Lab has been doing very interesting work with an enormous data set of people on the caseloads of multiple public systems in Los Angeles. Their analysis indicates that across caseloads comprising nearly 2 million single adults, less than 2% of those individuals fall into homelessness each year. And yet, the majority of single adults who do enter homelessness are on the caseloads of those public systems. So given the data that they had on hand, they sought to develop a model to predict which individuals become homeless, either for the first time or once again. Of the top 3,000 individuals, of those nearly 2 million individuals, they identified at highest risk, less than half actually became homeless, although the risk of homelessness was nearly, oh shoot. Can you all see me? I'm sorry, my computer screen went blank and you all heard me cuss, and that's awful too. So I just thought my computer died, so I apologize. So of the 300 individuals that you saw the real me there, so I apologize for that. So of the 3,000 individuals they identified at highest risk, less than half actually became homeless, although the risk of homelessness was nearly 48 times as great as the average county client. So even with extensive data, identifying the needle in the haystack, those most likely to enter homelessness is challenging, and the tools are imprecise, but it is evolving. The California Policy Lab also provided evidence of another great challenge in preventing homelessness, finding those most likely to become homeless when they're not actively seeking assistance to stay housed. Of the California Policy Lab's data, they found the top 1% at highest risk of homelessness was nearly, it was in the thousands, tens of thousands. And yet of those thousands of individuals at highest risk of homelessness that they identified, only 23 received targeted homelessness prevention assistance. So LA created a very large homelessness prevention initiative to go after the highest risk individuals. And of the highest risk individuals, only 23 got it. So homelessness prevention programs, even if well targeted to high risk individuals, will not do much if the interventions do not reach them. So how do we offer help to those not seeking help? If many of the individuals who become homeless for the first time or for a second, third, or fourth are already on our partners' caseloads or interacting with other systems of care in our community, then we need to institutionalize ways to identify and to reach them. This can largely be achieved through data and partnerships. Helping people avoid and end homelessness is a win-win for everyone. It's not only good for the mission of ending homelessness, it improves outcomes across many domains. Helping people in criminal justice system at risk of homelessness can not only prevent their homelessness, it can prevent recidivism. Helping children at risk of entering shelter can reduce school mobility, improve attendance, and academic performance. Helping those with severe health needs stay housed also helps them stay healthy and avoid recurring hospitalizations. So preventing homelessness actually needs to be very strategic. It's not easy. It's not anyone with in rent arrears. It has to be very carefully and narrowly targeted. So if we go to the next slide, I have some recommendations. Intervention should be informed by what we know from national research and data, but it should also be grounded in your own data. Who's coming in? Where are they coming from? What are their characteristics? And then work backwards through that. The data that we look at, our local information, should include the perspective and the insights of those with lived experience of homelessness who can talk about the failed safeguards along the way and why they didn't work for them. Strategies have to be built to promote racial equity. It won't happen by accident. We can see this by the vaccine distribution and the inequities that continue. We know it's there, and yet somehow the way that we're delivering aid is not achieving equity. Localities should plan to continuously assess performance and adjust interventions as needed. Are you reaching the highest need folks? And then public systems serving populations highly vulnerable to homelessness can greatly advance progress through several activities. First, if you go to the next slide, screening their clients for risk of homelessness and connecting them to interventions, creating those interventions in-house or through external partnerships, collecting, sharing, and facilitating cross-analysis of data to improve our collective capacity to identify those at highest risk of homelessness, and leveraging their own expertise. They're the ones that have relationships with highly vulnerable people and their resources to help end homelessness for the clients they serve. This stimulus, this COVID crisis, and the new funding that the administration is making available provides an enormous opportunity that will enrich many public systems of care to enable them to go a very long way in preventing homelessness and improving housing stabilities for some of our most vulnerable and at-risk neighbors. Making the most of this opportunity requires a commitment to use the best information, to be strategic and straight true to the goal. I'm really grateful for IForum's leadership to make this happen. And I'm also struck, if I can just say an aside, that if we think about the billions of dollars that are in the emergency rental assistance that are going to community-based organizations, having a better sense of who's on your caseload that really is at the highest risk of homelessness will allow you to stabilize those folks. So there's a really vested interest in seeking out who those folks are to enable them to make use of resources that are outside of your own control too. So really we need collaboration to make the most of this opportunity in front of us. So now I want to start off with the panel and first give you some larger overview. As Connecticut works to end homelessness through upstream prevention efforts, having a coordinated system of care can help foster linkages and referrals for individuals. This can help agencies prioritize care and housing coordination for at-risk people. Systems integration can occur through a coordinated effort to address social determinants of health. State agencies, nonprofits, and healthcare systems can come together to share organizational strategies and foster cross-system collaboration. So the organizers are hoping to walk away from today's IForum with an eye on partnership opportunities that shift services upstream to reach more people before they become homeless, and that can better match services to need so that people receive the right services at the right time, improving the client experience, improving outcomes, and expanding knowledge of where the gaps are in our system. So after we hear from our speakers and panelists, we hope to have an opportunity to hear from you as it relates to prevention efforts, creating a common language using data and how to use that data across systems to benefit the clients we serve in more effective and preventative ways. They have assembled a panel of experts from Court Supported Service Division, the Coalition for Juvenile Justice, Greater Waterbury Health Partnership, and the Department of Children and Families. Let me introduce our speakers who will provide a brief overview of their prevention initiatives. Mike Ayala is a program manager for the state of Connecticut, Court Supported Services Division, and he will talk about a housing survey that was developed over a 3-year collaboration that identifies housing status for those entering or exiting their system. Naomi Smoot-Evans, Executive Director for the Coalition of Juvenile Justice, will talk about Collaboration for Change, an effort in the Stamford area that hopes to improve outcomes for youth in the juvenile justice system who are homeless or housing insecure. Ken Misoglan, Bureau Chief of External Affairs from the state of Connecticut, Department of Children and Families, will provide an overview of Family First, a federally funded statewide prevention program in Connecticut designed to prevent high-risk youth from entering foster care. Angie Mathis is the Executive Director of the Greater Waterbury Health Partnership, and she will share information on a new initiative that is collecting housing status upon entry into their system of care and linking it to the community care teams and their federally qualified healthcare center. After we have heard from those speakers, we will follow it with a panel discussion with experts from each of these initiatives who can provide more operational elements of these groundbreaking efforts. The panelists are Joshanda Guerriere, Administrator, Clinical and Community Consultant, co-leads the Family First Initiative at DCF with Ken. Leslie Swiderski, Waterbury Health Access Program, will provide some insights as it relates to care coordination and better client outcomes. Tasha Hunt, the Deputy Director of Juvenile Probation Services at CSSD, will highlight how this survey was operationalized and provide insights into where it's headed. And Sharon Green, the Juvenile Matters Supervisor 1, will talk to us about the intersections of youth who are involved in the juvenile justice system and homelessness and what we can learn about both. And with that, I turn it to Michael. And apologies for the swearing.
Trust me, I understand your frustration with technology. My name is Michael Aiello, and I work with the Judicial Branch Court Support Services Division. And I want to talk to you guys today about an exciting new project, the Housing Stability Survey, which we initiated across all of our disciplines: adult and juvenile probation, bail and family services, and juvenile detention. And some could ask, why is it important that criminal justice folks, try and collect this data? We know it's important because we know stable housing provides a platform which increases client engagement, supervision, and affords the client the opportunity to participate in community-based programs and services. This leads to better outcomes, reduced recidivism, and public safety. I can't echo enough the collaboration between the housing specialists, the partnership, CCH, and our other state partners in making this all happen. So the branch, about 3 years ago, in collaboration with CCH, the other Reaching Home campaign members, the partnership, DOH, and some of the community stakeholders, put together this brief housing stability survey that'll help identify homelessness and unstable housing instability in the criminal justice system. We took the initiative to put this in our case management system, not make it a standalone data collection system. By allowing us to do that, we can more efficiently manage the data. So for clients on supervision, the survey is conducted twice: an initial survey and a survey at discharge when they leave probation. During the time they're on probation, if their status changes as they see their probation officer, they then will go in and make a change. For the other housing, for the other disciplines, it's not as simple. Places like bail, where they only have that one interaction with the client at arraignment, that's usually only going to happen once. But it gives us a good idea of the pretrial clients coming into the system who are identified as homeless. In addition to collecting the data related to the housing status, we provide action steps. So as people are identified as either unstably housed or homeless, there are action steps built into the system that tell our officer what to do, whether it's call 211, engage in emergency housing services like rapid rehousing, which is a new initiative we started with the Department of Department of Housing, or our own transitional housing network. We began doing surveys on June 28th for adult and juvenile probation, as well as juvenile detention, and with the other disciplines came on board in September 20th. In addition to the housing surveys, CSSD and the Reaching Home partners are developing a webinar that will help train our staff to get them to understand the significance and the impact that housing has on our client population. So if we want to go to the first slide, some of the initial housing survey data, you can see already in probation, we've collected 16,000 surveys, in bail, 7,600, in family, 3,800, and in juvenile probation, 2,700. I gleaned out some information that I thought would stand out and be important to see. As you can see, those stably housed, bail and juvenile probation, significantly less than family and adult probation. You can see by the numbers there. Those living in shelters or defined as somewhere outside, bail is significantly more likely. So those pretrial clients are significantly more likely to be in a shelter or living outside. Those that are identified that couldn't stay where they were any longer, again, bail significantly higher than the other disciplines. Those that don't feel safe where they're currently living, unfortunately, bail again. Pretrial clients don't feel safe where they currently are. The housing survey, it's important to mention this now, the questions across all disciplines are very similar. There's only some slight variation in the juvenile version, where we talk about things like, in the other versions, it's, do you feel safe where you currently live? In the juvenile version, it asks specifically, are you experiencing any harassment, any abuse, any sexual harassment, any sexual abuse? It gets a little more specific. But in general, the questions are all very similar. This way, we're able to compare an apple to an apple. And I think that's important as well if other disciplines, other agencies begin to use this housing stability survey. One of the other things that I thought was important is there are 156 juveniles living in alternative housing, foster care, residential programs, and another 92 that are currently in detention or incarcerated. That's significant because that's 156, possibly over 250 clients who, when they leave that housing, do they come back to a stable or safe housing situation? Next slide. Some of the other things we're doing, and again, a lot of what we do is based on racial disparity in the criminal justice system. I took some information, race and ethnicity in our adult probation population. Again, some things that I thought across the survey that were significant. Those identified as owning their own home or apartment, if you can see, Hispanic and non-Hispanic Black, significantly less likely to own their own apartment or their own home. Same thing if you look at those in hospital, drug treatment, rehabilitation center, or even transitional housing, Hispanic and Black, less likely to be in drug treatment, hospital, or some type of rehabilitation center. And I think it's significant because to address this, one of the things we always talk about is we will easily create, criminal justice in itself creates a segment of the population that is going to be chronically underserved. When you add into that a lack of stable and secure housing, we're going to create a permanent underclass of individuals that'll never have access to bring themselves out of it. And that impacts the entire system. So hopefully in the future, as we get closer and closer to doing this statewide, we're going to be able to figure out a few things. One of which is a system of data sharing that will allow us to not only look at the aggregate data, to say, okay, we have these issues that drive public policy and resources, but on a client level, be able to share this information so that clients leaving judicial, the court, going to DOC, DOC will be aware that they're homeless or unstably housed and be able to make plans and case planning. They can work with probation on the other end, again, building case planning based on housing instability and homelessness. We definitely want to be able to identify the risk of people leaving DOC who are at risk of being homelessness to prevent it, to begin working with them early. And lastly, the important piece of this is to look at the racial disparities so we can attack this in a more strategic manner to address something that is not unique to the criminal justice system, but more indicative and reflective of what happens in society on a larger level. Now I'd like to kick it off to Naomi.
Thank you. I think Mike had talked a little bit about collaboration, and that really is key to what we're doing in our project at the Coalition for Juvenile Justice. My name is Naomi Smoot-Evans. I'm Executive Director of the Coalition for Juvenile Justice, and very grateful for the chance to get to be with you today. Next slide, please. We started working about 5 years ago on a project that we call Collaborating for Change. And it's really just that, right? It's making sure that we're bringing folks together across sectors to address the issue of youth homelessness and interaction with the justice system. The project really has two key goals. The first being make sure that folks aren't criminalized for experiencing homelessness. And the second, like Mike was talking about, make sure that when folks are exiting the justice system, that they're exiting to safe, stable, and secure housing. That looks a little bit different from our work's perspective. We're talking specifically in our work about folks primarily who are under 18. Those folks who are 16, 17, on their own, maybe couch surfing, maybe staying with friends, maybe doubled up. And I think that's one of the really tricky populations. We see that a lot of times those folks are coming into contact with the justice system for low-level behaviors like skipping school, being out after curfew, things like that, survival crimes as well. But those are also often the most challenging folks to find solutions for, right? You're not old enough to enter into a contract yet on your own. Parents still may be in play. And so bringing together folks across systems is really critical, both in terms of addressing problems that have already arisen and in preventing homelessness before it starts. I often think of the youth justice system as a real opportunity point. It presents a lot of challenges and it presents a lot of opportunities as well, because it's a place where we know young folks who come into contact with the youth justice system are more likely to come into contact with the adult justice system. They're also more likely to come into contact with the youth homelessness system. We've seen a dramatic decrease over the past 10, 20 years in the number of young folks who are coming into contact with the youth justice system nationally. But there's still a disproportionate number of those young folks who are youth of color. And there's also still a disproportionate number of those young folks who come into contact with the youth homelessness system. Nationally, research shows that about 78% of young people who are experiencing homelessness will have at least one contact with law enforcement. So working together across systems is a real opportunity point to make sure that those contacts with both systems, ideally, can be eliminated and prevented, and that young folks can get the services and supports they need to address the underlying issues that are going on in their communities. One of the main challenges that we see when trying to work across systems, though, is data, right? I think that is one of the things when we come into a community to provide TA, the first thing we ask that community to do, and including Stanford, where we've been working for the past year and a half, is to share data with us. What does it look like? How many young folks are experiencing homelessness? How many of those young folks are also coming into contact with the justice system? We know nationally, thanks to Chapin Hall, that about 1 in 30 young folks between the ages of 13 and 17 will experience youth homelessness in a given year, meaning that they're alone and experiencing homelessness without the supports of their family. But we really want to get a sense for what that looks like in the community itself. And data we have seen across the country is challenging to come by. I was actually on a call yesterday with another community, and we were talking about sort of this gold standard data collection method, but also talking about the fact that money is always limited in communities. Budgets are always a reality that we have to contend with. And getting agencies to talk to one another is also sometimes not as easy as it could be. So sometimes simple data collection methods to get started, right? Going old school and collecting data in a spreadsheet can be an option when we're in those early stages of collection. Two of the things that we've been working with folks in Stanford to create is trying to get a team together so that we can look at a young person's needs holistically, right? What is the underlying trauma that they might have that needs emotional support to deal with? What are some of the immediate needs like housing? How are they going to get to school? All of those things so we can come together and make sure that young folks are getting their needs addressed holistically. And we'll be talking a little bit more about that during the question and answer section. But just again, before I kick it over to Ken, just wanted to highlight that the gaps can often be both opportunities and challenges. At the federal level, often, when data is missing, that can be a tool. Getting that data can be the tool to get to the next step in reform efforts. So thinking about those missing pieces, yes, it's hard to get data, but it is both an opportunity and a challenge. And I'm going to turn it over to Ken now.
Well, thank you so much, Naomi, and what a great opportunity to come together and talk about how the work of the Department of Children and Families and the federal Family First Prevention Services Act really melds into and connects with all of what we've talked about this morning. So I'm pleased to speak on behalf of my colleague, Joshonda Gurrier, and myself. We are the co-leads for our Family First Prevention work with the department. If you can go to the next slide. So what is our Family First Prevention Services Act? And I'm sure many of you on this webinar today have heard about it. So the Family First Prevention Act is actually federal legislation that was passed in bipartisan fashion, which simply put places focus on prevention in child welfare, which will lead to more families remaining permanently together. It allows differences and changes in funding streams, so states can draw down additional 4E dollars for services and interventions that they are in fact putting in place. But most importantly, what this does is it puts jurisdictions in a position to place focus on prevention. And what states and jurisdictions are required to do is develop a statewide prevention plan, which identifies those families that we believe are most in need of supports. So the state as a whole can get way upstream and provide supports for families earlier on to hopefully prevent them from having to have a call to Child Protective Services and without question having to enter into foster care. What we are looking to do is to develop community pathways, to create them for families to access family-centered and community-based resources much sooner. We know that the federal government has incentivized evidence-based services which address mental health, substance use treatment, and in-home parenting skills training in ways they have not done so before. And when we look at these factors, untreated mental health, active substance use, those factors certainly play into a family's ability to remain stably housed or not. What this act also does, and what Connecticut is taking a look at, is developing what we call kinship navigator programs, whereby we are in a collaborative fashion going to streamline our information, referral, and follow-up services to relatives raising children. We know that there are thousands of children across Connecticut that are actually being raised by others that are their parents. And so how do we coordinate our services to ensure that we have continuity across our systems and in our local communities? And lastly, this Family First Act requires higher standards for treatment of youth that if they cannot be maintained in a family setting and have to go into a congregate care setting, there are additional requirements of what that setting should look like to optimize that child's care. So to summarize what we have in front of us is the Family First Prevention Services Act, again, incentivizes states to develop prevention plans and services for families to get upstream to ensure they have supports in a timely, community-based, family-centered way. Part of that plan identifies those families most needed supports, and Connecticut has certainly identified youth who are unstably housed or homeless youth as those individuals that we also need to pay close attention to. If you can go to the next slide. So when we think about our Family First work, it's a part of the state's greater prevention plan. We have had over 400 unique community partners that have joined with us over the past year and a half to develop this prevention plan. State agency commissioners, contracted providers, grassroots organizations, individuals in the community who provide perhaps therapy to families, but also we have engaged parents with lived experience and youth to help us understand what their experiences have already been while trying to access supports within Connecticut's greater system and how they would like our system to look in the future. And Joshanda and I engaged in 3 community listening sessions, group discussions with parents who are experts, and received just significant information from them about what they would like the future to look like. So we can go to the last slide. If you'd like more information on our Family First work, please look at our website, ctfamilyfirst.ct.gov. Our email address is also listed there if you have any questions or follow-up. Any documents we've used, our PowerPoint slides, you'll see some great videos that include presentations in longer format about our Family First work, are all up there on the website. And we really encourage all of you to take a look if you're not actively part of our work groups right now. And we look forward to submitting our Family First prevention plan, the state's prevention plan, that first week in May. And then becomes the hard part, hint, hint to all of you. We now need all of you to join us on the implementation stage to push this through for our children and families. And now I think I'm going to segue to Angie.
Hi, everybody. Good morning. It's my pleasure and honor to be invited to talk to all of you this morning about something really innovative and exciting happening here in Waterbury, and that is the Greater Waterbury Health Partnership. and particularly its program, the community care team, and its relationship with homelessness, homelessness prevention, and its effect on the health system. So first, we get a lot of questions about what the partnership is. And my first response is always, well, it's complicated. And it is, as most good things are that are collective and collaborative that involve many organizations. So the partnership began in 2013 as a cross-sector collaborative of partners working together to advance improved health systems, health outcomes, and data collection for the purpose of greater health equity. And our partners are listed here, and this is an important thing to note. The partnership would not be possible without the very active participation, idea sharing, and really oversight of these groups, as well as funding. Chesapeake Health District, the City of Waterbury, Department of Public Health, the Connecticut Community Foundation, Trinity Health of New England, St. Mary's Hospital, Staywell Health Center, who is also our fiscal sponsor, United Way of Greater Waterbury, and Waterbury Hospital. You can advance to the next slide, please. So really the thing we get the most questions about is what is the community care team? And I'll talk briefly about that, but really about its relationship to homelessness prevention and improvements in the health system as related to homelessness. Coincidentally, we are running a community care team meeting right now. So a CCT is based upon a state model, I guess a relatively informal model of intensive case management for high utilizers of emergency departments and hospitals. It's typically a weekly case management meeting. The CCT connects partners, community-based organizations, and clinical partners to share, discuss, and refer high social needs clients to each other in an informal setting. So we spend a great deal of time curating a list of patients that are eligible for the community care team. And those lists come from our 2 hospitals and sometimes also from our participating partners. They meet specific criteria on overutilization or superutilization of the hospitals. And they also exhibit many of the social determinants of health, particularly homelessness, substance abuse, and mental health or behavioral health issues. CCTs are comprised, so the actual team is comprised of doctors, ambulance, law enforcement, social workers, case managers. The homeless outreach community are big participators in our CCT, recovery coaches. This is really just to name a few. We also have folks from accountable care organizations on the CCT. We have the opioid task force from the City of Waterbury that we work very, very closely with, amongst others. Members of CCTs get an intensive overview and knowledge of a patient's activity and needs, often working together to assist a patient wholly for medical, housing, food, documentation, etc. This becomes a very intimate setting for which all of these partners to really take an active role in a patient's whole care. And often, because our patients are battling housing instability and homelessness, it helps us really stay connected and close the loop of their care much more effectively, because all of these folks know they're going to be meeting in a forum every couple of weeks, and they'll be able to get updates and provide updates on these shared patients. So really, CCTs are working together to remove barriers for patients that are caught in a hopeless cycle of hospital visits. You can advance to the next slide, please. So I think this is the exciting slide for us, right? We're a pretty scrappy little nonprofit in Waterbury. We have a lot of challenges. I'd be lying if I told you that this was easy. We've spent the better part of 2 years trying to get this program off the ground. Our program is primarily funded by the Connecticut Health Foundation. We were the only organization in the state. Well, there was 2 organizations awarded a clinical community integration grant, but we are currently the only organization still implementing that work plan in the state. So we're really excited to share some of our outcome data with you today. The Waterbury CCT has reduced all hospital utilization in its patients by 45% in the first 6 months. This equates to over $1 million in saved hospital costs and reduces the strain on law enforcement, housing partners that frequently are called to intervene with these patients. This is significant. I want to briefly just mention that our first 6 months only included 12 patients. We're still within the first year of this program. As of May, we'll have completed the first year. We are now up to 22 patients. So I've just completed the second quarter data, which we'll be sharing at the end of April. On average, we have 28 community and clinical partners from many sectors participating in biweekly case management meetings. I believe today we have 24. Sometimes we have as many as 45, depending on what the needs are. In the first 17 CCT patients in the Waterbury pilot group, there has been over 100 linkages and referrals to social and clinical services. I should mention this number is slightly underreported. We're also utilizing a database called Unite Us. You may have heard of it. We've been using Unite Us for about a year now, and due to the pandemic's onset in April, it took us a couple of months to get our feet wet with Unite Us. So when I talk about linkages and referrals, that's really the meat, right? The bread and butter of the CCT program. How many times did a client or a patient get connected to a housing service, or to utilities assistance, or to food assistance, or onto a primary care appointment? So that's what that's tracking. Over half of the homeless CCT patients have been stably housed since the intervention. Others remaining have been placed on housing lists. So this is really significant for us. Almost all of our patients are dealing with housing instability. That seems to be the primary driver of all of their superutilization. We know our hospitals are challenged, and even more so with the pandemic challenges. One CCT patient that we currently have is now housed and employed full-time. So I didn't mention that we also have employment partners on our community care team. This particular patient has not experienced any other utilization since the CCT intervention. CCT has facilitated conservatorship, placement in residential treatment and psych beds, medication-assisted therapy, and intensive outpatient therapy. We're really excited about the success that we've seen in just this first group of patients in the first 6 months. We're still learning about how that information and that data changes. Even with just a couple patients, should one or several of our partners not be able to intercept them when they have a weak link in their care again. You can advance to the next slide. So really, that's the most exciting news. We do many other things at the partnership, including a maternal health work group where we're working on strategies there. And we also do our community health needs assessment, and we utilize all of that data. We author that report for the health system, and we utilize all that data to inform our strategies and decision making. So if you want to learn more about us, I could talk all day, but I will not do that. Our information is here on the screen, and I know that later on, Leslie Swiderski, who is our lead case manager for CCT and an absolute dynamic powerhouse, as well as just really the most knowledgeable person I've ever met on 2 feet when it comes to case management. She'll have some great insight to share later on in the IForum. So thank you so much for the time today.
Thank you. So this is a really very impressive group of panelists. This is a very impressive group of initiatives. And so we want to invite a few more speakers to the table for the conversation. We are going to invite Joshandra Guerrier. I'm going to try Joshandra Guerrier, Leslie Twardowski, Tasha Hunt, and Sharon Green. We've heard about the initiatives at the sort of at the top level, high end, the goals. So I'm wondering if each of you could expand, and I'll start with Joshandra, on what you think the improved information about clients' housing needs, housing status, homelessness, intersection, and collaboration across systems. How is that going to benefit your clients? How are their outcomes going to be different? How is your system's outcomes going to be different?
So our agency's philosophy is to ensure that families leave our system better than when they entered. And so to ensure this, we are continuously reviewing our work both internally and in partnership externally with our stakeholders to enhance delivery and approach to better serve our families. So as a system, while we have evolved from a results-oriented accountability framework of monitoring our child welfare program outcomes and applying a racial justice lens to them, to now taking on an either further step to becoming an anti-racist organization, our beliefs, values, policies, and practices really are going to be threaded through a lot of this work that is occurring. You heard some of the other overarching presenters talk through how they have that lens on their work as well. And so collaboration is something that's always evolving. It's something that we're always working towards to ensure that we are looking at the bigger picture to drive our prevention plan forward, as indicated by Ken's presentation that spoke to the system and not just the DCF's work at hand.
Thank you. Leslie, do you want to talk about the benefits for your clients for the improved collaboration and improved knowledge of data?
Sure, and I want to apologize only because we're actually doing a CCT meeting in the other room right next door. So we're running back and forth. So we have our live every 2-week meeting. So, you know, I look at what we've done here in the Waterbury area as a really successful collaboration of providers who have really come together, and as a team rather than as an individual hospital or an individual provider. We have the Department of Social Service involved. We have the Department of Mental Health involved. We have St. Mary's and Waterbury Hospital staff, Stay-Well Health Center. And when patients, the shelter, St. Vincent de Paul is extremely connected. So the CAN committee. So what we're finding is that when you pull together all the clients that we are working with who are identified as housing insecure, it's amazing how these partners all pull together to collaborate on how we help these clients become more stable, whether it's their mental health issue, their substance abuse, a medical illness. And when you're able to navigate them through the healthcare system and through the homeless system, and we collaborate with how do they get to their appointments, and the shelter staff make sure that they get there. And it's this huge collaboration. You know, one thing that I will say is that I think it would be great if we could identify these clients. We're identifying them right now as super overutilizers of the ED, which means to me, we've got them at a point of being quite ill. And so it would be nice if there was a way to tag these clients as we move on and more funding's available. I'd like to be able to tag these clients as being homeless prior to them showing up with major illness. But I do feel like we've really gotten our arms around our most vulnerable clients and have been very successful in doing so.
Great, thank you very much.
Thank you.
Tasha, how have your clients benefited from the better data and greater collaboration, and how will they benefit?
Sure. You know, I think the beauty of this work within our agency around the housing survey, as well as the work that Naomi talked about regarding the collaborating for change, for us, we think that we are in a better position to respond to the needs of the children and families we serve. Both projects really started from the ground up. And I think that's what's most important when you think about system change. I think sometimes you can make policy changes at the 30,000 foot level and expect that everything will work out. But the way we design, you know, the housing survey, even though it was a system approach, we really did rely heavily on the input from our field officers, our field supervisors around, you know, what are we currently doing? Because I think it helped us better understand what we're missing. And so by going through this process of developing the survey, you know, from a system level, I can share with you that we are now able to really recognize where the gaps are. We can develop policies based on the data, you know, that we receive from the survey. We can really look at how we allocate our funds. You know, what are our programs looking like? Are they meeting the needs of our clients? And through some of the work in Stanford around the collaborating for change, it allows our probation officers, our probation supervisors to have a more hands-on approach and a formalized, you know, process for addressing the needs of a population that I think sometimes, you know, is unnoticed because they're in that gap that Naomi talked about, the 16 and 17-year-olds and just the complex, needs they have, and which system do they fit in. So, I'll turn it over to Sharon to talk a little bit about what's happening locally, particularly with the Collaborating for Change and how probation officers, are really relying on that approach in the information from the housing survey to drive practice. Sharon?
Hi, hi everyone. I think Naomi referred to the Collaboration for Change project and how we worked with them over this last year. And that has contributed greatly to many of our diversion methods. And I'm just thinking about over this past year and a half, how that served as a catalyst with helping to bring the issues of youth homelessness, but even more specific than that, the issue of juveniles who are homeless in this state onto the agendas of many of our local community service providers in the Stanford area. So when I think about diversion methods, I think about collaborations, I think about Naomi's presentation in regards to the importance of all of those things when trying to end homelessness for juveniles in our systems. I think, in terms of our locally in Stanford, what our participation in that project has done, it has resulted in many of our community stakeholders, like our police departments, the local YSB, our local shelter, Kids in Crisis, DCF, the Board of Education, all of us coming together to build our knowledge base on really what it means to be a juvenile involved in all of these various systems, and how being homeless or insufficiently housed really complicates things further, right? And in coming together, we were able to look at what these resources were in our communities, categorize them in a way that we were able to define them as resources that we were able to put them together immediately, resources that, like Kids in Crisis, we can use right now, right then and there, resources that exist but are just not appropriate for our young people right now, such as our 211 system, how it works effectively for our adult population, the way it's set up now, but it wouldn't serve our juvenile population so efficiently, because with juveniles, we know that their needs are more unique. There needs to be a little bit more hand holding. So we're thinking that while that system is so, on so many levels, it's so effective for our adult population, it may not work out so much for our juvenile population. And then we talked about those resources that are just non-existent, but should be, simply not. But if we're looking to end homelessness for juveniles in Connecticut, those resources should be long-term shelter placement, short-term respite placements like host homes in the community, places that our police departments can refer to and things like that. So if we're looking to make gains in diverting juveniles from our system, we're looking forward to continuing to hosting events like this. We're looking forward to continuing to have a seat at the table on projects like those of the Reaching Home campaigns, initiatives, those of the partner, working with the, I'm just trying to think of all of these initiatives. The Youth Homelessness Demonstration Program will continue to keep providing data and reporting from a juvenile's perspective on those platforms to keep this issue relevant, because it's super important that we continue talking about this so that we're heading in the right direction to keep this thing going. Thank you so much.
Thank you, Sharon. And I want to invite folks to submit questions. We have a little bit of time to take it from the audience, but before we do, I have one general question for whoever wants to take it. I think it was interesting that Sharon and Leslie both spoke to but it's not quite good enough. You know, we need the adult system, we need to adapt to get to juvenile and make it juveniles and make it work better for youth. Leslie, it's great that we're getting the high utilizers. It'd be great that we caught them before they were high utilizers and their health was less damaged. So if you think about collaboration, if you think about collecting data, if you think about the next initiative, where you want to head, what's your dream? Where do you want to go? Anyone that hasn't spoken to that? And for the audience, please submit your questions. So is there, you know, something you're excited to take on to advance your work? Michael?
Yeah, I can tell you one of the things that we're thinking about doing and working with CCH in partnership. Once we have this housing data and we have our action steps, directing our staff things that they can do, the case plan, is actually sharing more data. We're thinking about piloting with CCH view-only access to HMIS. So as our officers identify someone who's unstably housed or homeless, they can also review some of the case history around the client and then work with them and work with CCH or the local CAN to then better direct services. I just think they're natural progressions. And the first step is collecting the data, having a data set that gives us an actual picture of the homelessness disproportionality in the criminal justice system versus the larger system. And even within that, by race, gender, age. Without that data, I think it makes it very difficult to move forward. But with that data, we can move in almost any direction. So I just thought that was important.
Naomi?
Thanks. Two things to piggyback off what Angie and Michael were just talking about. And I'm going to try to take my hand down. There we go. Still learning tech after a year and a half stuck in my house. But to Angie's point around the teams that they're doing, those are such a wonderful model that in our work in Stamford with the local community there, that's really what we're trying to embody, right? But catching folks while they're still young, while they're still minors, while they're still having those first initial contacts with the youth homelessness system, so that we can get to that goal of catching folks and providing them with services younger. And then one other opportunity to Michael's point around racial and ethnic disparities, right? That's something that we see pervasively in the youth justice system and in the youth homelessness system. And not surprisingly, because it's often the same young folks who are shuffling between systems. There is a huge opportunity at the federal level called the Juvenile Justice and Delinquency Prevention Act. Right now, Connecticut is not a participating state in that act, but it is one of the only federal laws that requires us to measure and take actionable steps to address racial and ethnic disparities in our justice system. So just flagging that as another opportunity as folks are looking towards kind of what's next on the horizon to address those issues.
Ken?
Great, thank you. You know, I just wanted to make, I guess, a comment, but also an observation of how many times we've heard in the hour that we've been together the word team or collaboration or joint efforts. And really what I would hope for the future is we really continue those efforts and understand that when we have a family in front of us or a youth that may be struggling or unstably housed, they have tended to touch multiple systems of the individuals that are on these calls. And one of the things that I think Joshanda and I have learned so much about our work in developing and leading the statewide prevention efforts for the state is how many of our families cross multiple agencies. So our families need us, our youth need us, they need our continued collaborative efforts, and they certainly need our teamwork. And I think the pandemic probably has enhanced that, but also helped us realize that in so many more ways than we even realized. So a thought on that I just wanted to share how great it is to hear the language and see that the cross work that we've been able to do.
Anybody else? Turn to the next question. So for all the panel,
I'm sorry, just to weigh in, collaboration is key. And I think that we really need to keep in mind that as we collaborate, we need to ensure that we are constantly checking in with our young people and checking in with the population that we are looking to serve, to ensure, just keeping our fingers on the pulse of this situation to ensure that there's a checks and balances, checks and balance system that's taken place to ensure that we're doing right by them as well. I think that a lot of times that we're putting into place these systems and policies, and we mean well, but we do need to make sure that their voice meaning the voice of the young person, the voice of the families who are most times, like many of us have referenced, are just not represented in many of our just not represented, that we're checking in with them and that we are representing what it is that they're telling us is working, period. So before we move on, thank you.
No, that's perfect. They're the most invested, the most vested interest. They're the most important critical partner.
Absolutely, Sharon. And can I just piggyback off of Ken and Sharon, because when I think about their reflection of collaboration and partner and stakeholder involvement and all those things, I think we as a system also should be mindful of language. We get caught up into our lingo, if you will, in our respective areas. And so when we think more broadly about collaboration and the opportunity for us to come up with some key threads of language that's common across systems, so that families also are able to understand what we're talking about and make a conscious attempt to reduce the number of acronyms that we use and really say the words that we mean, because sometimes things get lost in translation. And so when we think about these systems and really think through significantly reducing the challenges and barriers that people are experiencing while increasing their opportunities for success, language should also remain at the forefront of thought.
And I think interventions need to be accessible, easy to find, friendly neighborhood places where people won't be afraid to seek help, and make it easy for you to find them. So there's a lot of bridge building work to do this well, to really get to the highest risk folks. So a question that came in from the audience was, what has been the role of municipal social services in your endeavors? And if not, what could it be? What should it be? And I'm not sure what municipal social services means. I might interpret it from out of state as being maybe welfare agencies, sort of the food stamps or TAN of cash assistance. But Michael, I'll start with you.
Yeah, and I only say this because I grew up in New Haven, spent most of my life there. So I'm and I worked for the city for a while, so I'm very familiar with the social service network, and they do a great job with limited resources. But I think what's important is stuff that's been happening more recently. Hartford, New Haven, and some other municipalities have created a reentry office, so they have staff dedicated to working with offenders coming back to the community. I think it's very difficult for people to navigate the system on their own now as it is. I struggle navigating the system. And I'm a professional in the system, and I still don't know everything there is to know or the right people to get things done. I think by having those reentry offices, I think having those collaborative councils, they have, the reentry councils where you have different different local private nonprofits working together with the state partners, talking about specific cases. I think that is very important. Again, the other municipal services, Department of Public Health, all those things are important. But I think for criminal justice, having that reentry office has been a significant help to all of the clients coming back.
Tasha?
Sure, thank you, Sharon. As I listen to Mike, and we work for the same agency, every now and then I'm just a little jealous because I'm like, man, we need that for minors, right? And so, that would be my dream if we were going back to an earlier question. But when you talk about just our work with, social service agencies, we cannot, just acknowledge the importance of the collaboration between the Department of Children and Families and the judicial branch in serving in serving minors and their families. You know, at the end of the day, you know, for anyone who's been around this work long enough, you know that a large percentage of children and families are dually involved in the child welfare and the juvenile justice system. And so a lot of times we are coming together to figure out on a case level, on a system level, you know, how can we better collaborate, you know, to ensure that we're wrapping services around our kids and our families, and that those resources follow them, you know, through a system. And so, you know, after almost 25 years in this field, you know, I think that we've evolved to a place where, you know, we don't see the same, you know, policies, the same barriers to accessing certain services. And so I think, you know, even today, this conversation you're hearing about, you know, the collaboration that's happening, the collaboration that needs to happen to make sure that we're able to address the gaps. So I think, you know, through some of this work, we've been able to figure out ways, you know, even with like the Family First Initiative, and we talk about vulnerable populations. You know, the first question is, where do we, you know, fit in? Where do the JJ kids fit in? And so, and I think that's wonderful because now we have a place where we can have that conversation, you know, a systems level conversation rather than the local case management conversation, which is critical, but that's going to drive what happens to that young person. It's not going to have the same impact that it can have on our state goal of making sure that our families are stably housed and that our kids are stably housed. So, you know, I think we work closely with DCF, you know, from where we sit as far as the other social service agencies are concerned. You know, probation officers kind of serve as what, you know, Mike referred to as those reentry, you know, case managers, because they're responsible as the case manager of that child's case to make sure that the child and family are aware of where the resources are. The one thing that I think that really came out of this pandemic is a lot of information about where to find resources. And so, you know, through this work, we've been able to say to families, did you know that this is available? You know, did you know that this is, you know, where you can get some of your basic needs? And then it also allowed us to look at our, you know, resources and figure out, are there ways that we could get creative with how we use our funding to fill the gaps? So, you know, I think, you know, what you're seeing here today is it represents the ideal scenario of systems trying to figure out how we can make sure that families are able to properly navigate the resources that are out there.
So we're getting a ton of great questions right now, and just sort of to categorize them, some are about how do I deal with all the confidentiality and HIPAA requirements to make collaboration happen. Some is how do I get my client or myself connected to this because this sounds good for me or a young person I know. But I want to go to one in the middle first because I want to round out the conversation. Somebody pointed out the importance of other sectors, including the faith community. Some of the faith communities having a nice base, a big base for communities of color in the reentry field. Are there partnerships there? Are you expanding out? How are you working with perhaps faith communities to impact diversity and to get to another population and to provide maybe more holistic services? Is that on the radar for anyone?
I know on the local level, they are always invited to the table and they are used and utilized as a resource on many levels, intervention, family assistance, counseling. They are looked to by probation officers, not just to serve in terms of homelessness, but support, direction, food. So faith-based communities are a fantastic resource. On the local level, they are utilized greatly.
Anybody else? Okay, so does anybody want to speak to how they broke through HIPAA requirements and other confidentiality issues to do data sharing? Tasha?
So I'll take a shot at it. That is definitely an area where I feel as though we've grown, but there's still work that we need to do. One of the things that we did, just more generally, speaking, not just to the survey, is, we always have to go back to the statutes. For anyone who is attached to this work, in the justice field, I keep a nice fresh stack of, the general statutes nearby. Because if you look and you dig deep enough, you'll see that there are ways that you can use, the law to allow for certain, types of sharing. So for some of the work that we did around the Stanford pilot, we really had to look to our confidentiality statutes, the juvenile confidentiality statutes, and how we can share information and with whom. And one of the things in our statute, it really speaks to the amount of information that you can share when you are seeking services on behalf of that child and family. And so that really opened the door to our ability, just as we would access, services in the community for a client, a specific client. We were able to figure out ways that we could communicate with the partners around the table who are all service providers, to really begin to talk about how can we develop this collaboration, this team approach to just talk about this child and family in front of us, without, the barriers. So we did rely on statute for that. It did help us get through some of the hurdles. I have to be honest in saying we haven't gotten through all of them. Because if you looked at the slide presentation, and one of the things that Naomi, mentioned was that this whole by name list, and how do we create a system that looks similar to what is available on the adult side, where you have notes regarding how families are assisted by various various agencies. How do you share that information legally? And so we're still working through some of that challenge, those challenges. With the survey, I thought it was excellent, when we were presented with the opportunity to be a part of this process, because it was all about, sharing information, not, client level information, but just de-identified information. And there are ways to do that within an agency that's supported by statute. But more importantly, it's also a way to go about just establishing memorandums of agreements. So there are various ways that you can get around the red tape. But I think the first thing starts with the willingness, the desire to be a part of the process, and to ask yourself, why not? Instead of, well, can we? I think we have to start from a place of, how can we make this happen? And it requires a shift in the mindset, but it's doable. And I see Mike has his hand up.
Okay.
And actually, Tosh, you actually touched on it. We are very cognizant of confidentiality. We're the judicial branch. I can't tell you the number of lawyers that are employed by the judicial branch to make sure we're always on board with confidentiality. One of the first things we want to do is get the aggregate data, have that on hand so we can look to see where there are gaps, where there are issues, to drive larger scale policy, larger scale funding. Only then will we look to at the specific client data to share with each other, and only after we have secured proper releases, which a lot of times we do in the branch. As our bail staff work with the client and we're making a referral to a provider, a program, residential treatment, we don't do anything without the client signing a release that allows us to share that. It would be the same here. We are not going to share any client level data without everyone being on board with it, without having interagency memorandums of understanding and agreement that allow us to do that. But I think it's important to understand that it's the aggregate data that we're going to start with. We are nowhere near sharing client level data yet. That is something we will work with together with the nonprofit providers, the partnership, to build this. This is very new to us. While I'm excited and want all the answers yesterday, I know through experience it's going to take a little while, but yeah, Tasha's spot on.
Okay, so I have a question, and I suppose everybody should weigh in on this. And I want to give some context. When I was fascinated by that California Policy Lab, you know, and one of data, the work that they're doing, and one of the things they found was that the people most at risk of homelessness were high system utilizers, but not just in one system, they were in multiple. So they might not show up as a high utilizer in the healthcare system or the jail system, but when you throw it together, you have mental health and substance use, and it was across systems. So that means the challenge of data sharing is that much greater. You've got to bring all the systems data together. So the question that I have in that context is, if the person is working for an organization, an agency that hasn't yet decided to even do housing screening, never mind all of that, and given how overwhelmed everyone is, what are some words of advice you would suggest that they offer up as, you know, this is why this is important for us to do this, to really understand our housing needs and who their clients are and how it intersects in the homelessness, housing instability space. What takeaway would you want to share to a colleague in another organization, another agency?
I can get us started. You know, I think one of the things that I talk about, especially with young folks, is just that we don't look at our own kids as just one aspect of who they are, right? Billy is more than just a soccer player. He's also a solid C student, and maybe he has a really great relationship with grandma, right? There are strengths and there are challenges for every person. And if you're looking at just the C's as opposed to Billy's a superstar on the soccer field, right? You're not going to get that whole picture. And we owe it to our kids and our young adults and to everyone to look at them as the whole person that they are, which requires us to break down those silos and to talk across systems.
I would say that to that agency, that time is of the essence, and that we only have a very small window and a very small amount of time to make an impact in the lives of these young people. And so if they are in this field to affect change, they need to do it, period. And so, and I think that there are many agencies represented at this forum that are collecting data, that have lots of information, they've done research, they are in the process of many different things that are willing to help. And so I think that is what I would say is, time is of the essence. This is urgent. This situation is urgent. And so if you need help, there are people available, there are agencies available willing to help. What is it that you need? Period.
Michael?
You know, I have been fortunate to be involved in a bunch of different collaboratives and initiatives. Connecticut is a very unique state. We have contact with other criminal justice entities around the country, but just in general, there's not the same level of collaboration between state agencies and community providers like there is in Connecticut. So we're very fortunate. I have been part of the Fuse Collaborative, where I identified people that were frequent users of DOC, frequent users of the homelessness system, where we did a data match. It's all confidential. It all goes to CCH and through HMIS, and through the shelters, they would outreach with clients to see if they want to participate with the housing voucher and services. This is another one. But if there's one thing I can give you and tell you, and Sharana's right, and I'm not a life coach, but it is that first step. We have to take the first step. So whoever you are, whatever state agency, whatever private nonprofit, the first step, saying, hey, the data is important. That helps us identify the problem, create policies, get funding. You got to take the first step. If you just sit back and think it's overwhelming or that we can't, trust me, we can. Because this, for us to do this in such a quick period of time, Gary, our executive director, Gary Roberg, when I brought this to him, his first instinct was, and we were thinking about adult probation. We were thinking our link with DOC, because we work very closely with the Department of Correction and Department of Housing. How can we make this work? His initial instinct was, no, we should do this in every discipline. It's important with every single person in our system, adult, juvenile, male, female. And he just said it, and then it was like, go about and make it happen. It took 3 years, but we made it happen. So it's that first step.
Great. Tasha?
I would have to say the end game. I think it's important for anyone who sees value in this and feels as though they need to gain buy-in, is that they have to figure out what's the end game for their agency. For us, at the judicial branch, we are certainly seeking to make sure that our families are better off, when they leave our system. And part of that is ensuring, when it comes to the children that we serve, is to make sure that they are not rearrested for any new offenses, that they're well off, and how do you get there? And part of that is through ensuring that they are stable. And so for buy-in for us and for our staff was all about, what is it for you, as a probation officer, when you're sitting down with a client on Friday at 4:45 p.m. on a long weekend, and they've said to you, I don't have a place to stay, and so at the end of the day, the buy-in for that officer, to participate in this survey was that this is going to help me describe, where the gaps are, what I need from my clients is going to help me, better serve my clients and families. And so they were all in, because we told them we're going to have data, we're going to share it with our partners. They're going to know what we're missing, when it comes to minors, and the lack of resources in our state, immediate, resources, things that are available in the moment at 5 o'clock on Friday on a long weekend. And so I think you have to figure out what's in it, for your agency from the top, and at every single level.
So I have 1 minute left, so I'm going to let Joshonda close it before I turn it back to Kylie.
All right, so as I sit here and I reflect upon what I hear my colleagues speak about in response to your question of hope, I hear know the whole person, time is of the essence, take the first step, use data, look at your policy, your funding, and what is your end game? What is your buy-in, if you will, from your stakeholder community with regards to your staff that's internal as well? And so what I would add to all of those things is leverage. So many times we tackle this work thinking that we're in it alone. You heard a lot today about collaboration, and the reality is we need to pause long enough to leverage the services and the systems that our other partners and our sister agencies and different entities bring to the threshold to be able to make this work doable for all. So look around you and take stock as to the resources that are at hand that might not necessarily be you.
And with that, I will turn it back to Kylie.
Thank you so much, everybody. That was an awesome conversation, and Joshonda really rounded it out so perfectly at the end. So thank you. I hope folks have watched this as I have and taken away a lot of great information and a lot of learning, but also a lot of hope and a lot of focus for moving forward with this work. This is really, really impressive work that's happening. I hope that you're all proud of the work you're doing, and so grateful that you are able to join us today and to share this work. I think it multiplies its impact and also spawns new work. So thank you so much. Thanks especially to Sharon for joining us today. We really appreciate you, Sharon, coming on board and helping to not only give the high level sort of national perspective, but also to help moderate today's conversation. I want to thank our PSC staff as well for pulling this together. Terry, Carlene, Kaylee, and Chelsea, Danielle, everybody here who has helped put this on. Thanks to our sponsors. I neglected to thank them in the beginning. As always, the Melville Charitable Trust, who funds a lot of the work that we've talked about here today, and also these IForums, DOH, the CHAFA here in Connecticut, also sponsoring IForums. And a special shout out to the Tao Foundation too for their support of some of the work, especially in the juvenile space. Much of the collaboration you heard there was funded in part by them as well. So thank you to them for being a sponsor for what we're talking about today. With that, I will also remind you all that the presentations in this webinar recording will be available on our website. So if you missed an earlier portion of this or you're interested in getting more information, that will be available on our website shortly, pschousing.org. And also feel free to reach out to myself or any of our staff today who've been here. If you have questions or want to get connected to one of the panelists here who you've seen on the screen and have further questions. So with that, I will just say thank you and send you all on your way. I hope that we'll all be able to do this in person together again soon, and have a wonderful afternoon, everyone. Thank you.
Thank you, everybody.
Thank you. Take care.
Thank you.
Thank you.